Only a few years ago, this theme would not have been possible. Our industry's research productivity was a challenge and subject to much criticism for a number of years. This has changed. Our companies have continued to invest substantially in research. In the EU alone, we invested an average of 25 billion euros every year for the last 10 years. This is why we're now seeing an exciting wave of innovation. 45 novel drugs received approval in 2015. Many of these innovations address diseases for which we had no medicines until now. And this is only the beginning. Here are a few examples of what's on the horizon. Cell therapy aims to reprogram a patient's own T cells so that they attack the cancer cells in the patient's body. This is a true step change in the fight against cancer. The promise of gene therapy is to replace a defective gene that causes a disease with a healthy copy of that gene. Gene therapy could ultimately help us cure diseases like Huntington's or cystic fibrosis. Exciting advances in disease-modifying therapy could also provide genuine solutions for Alzheimer's disease. First, healthcare systems are fundamentally not prepared for what's coming. Many of these innovations are potentially transformational, and they're so different from what we had before that the systems must adapt. For example, systems will need new capabilities to deliver cell therapy to patients. New financing models are essential for the combination therapies that are occurring in oncology, and to deliver gene therapy, new infrastructure and logistics networks will be required. Second, we still see that systems focus on inputs rather than on the outcomes that they achieve. Some of the amazing innovation that's on its way to market could truly revolutionize patient outcomes. By taking a total cost approach, systems with an outcomes focus are able to realize cost offsets and capture the full value of the innovation. But input-focused systems with their siloed budgets will struggle to survive. Third, we need much better organization of care to leverage the full value of these breakthrough technologies. Any medicine is only as good as a system that delivers it. Let me give you an example from Novartis. Our new heart failure drug, Entresto, reduced hospitalizations and mortality by 20% in clinical trials. But Entresto is only one component of care. In addition to effective medical care, we know that good heart failure outcomes depend on the patient receiving the right mix of primary, specialist, and community care. So if we want a product like Entresto to realize its full potential, we must closely work with systems to ensure the delivery of optimal health care. First of all, we need to help healthcare systems understand what type of innovations are coming. And we need to help them understand the impact on the system. From there, we can co-create solutions. Depending on the particular technology and the healthcare system, the way forward may be novel financing models, structural changes, or new capabilities. Let me give you some examples. Capturing the full value of a technology that provides positive impact over many years, like cell therapies, may be enabled with a financing model where the industry is paid for each year of survival rather than upfront. Adoption of a technology with uncertain budget impact, like combination therapies, may be enabled by effective real-world data capture. With enough time to plan ahead, relevant adjustments can be made to the system to allow these therapies to deliver their full potential. Second, our industry supports healthcare systems in their transition towards an outcomes-based approach. Systematically tracking health interventions and their impact on outcomes enables better choices. Patients can choose the best provider based on transparent outcomes data. Healthcare providers can benchmark their performance and learn from peers that consistently achieve superior outcomes. Systems can better allocate resources across all types of interventions and realize better value for money. Ultimately, an outcomes focus will help break down budget silos. Eliminating interventions that don't work frees up resources, and it can facilitate an environment where innovation can deliver its full potential. EFPIA supports a number of projects in this regard. Our IMI Big Data for Better Outcomes program aims to drive alignment on outcomes measures and creation of the right data for key disease areas. The Value of Health initiative that EFPIA participates in aims to create political will to measure and publish outcomes data. Lastly, if we want to partner in creating healthcare systems of the future, we need to do what we ask of others and move out of our comfort zone. This means engaging beyond pharmaceutical policy. It's a big task. But when I look back on my time as EFPIA president, I want to be able to say that we've done the right thing, to do everything in our power to ensure that the exciting innovation created in our labs realizes its full potential for patients and for healthcare systems when it comes to market.